Ari. Welcome.
Hey, thank you, Anna.
Thank you so much for being here. I truly appreciate it. I'm very lucky. Twice in a month.
Thank you very much.
So last time you were here for the grand rounds. As you know, we're doing these grand rounds in order to prepare ourselves and to shape next generation medicine. And as part of that, we invited you to talk about Alzheimer. Mm-hmm. You're, of course, as we all know, a global authority in the field, an absolute expert. So we really cherished your talk and the interaction with the audience. And so today I would also like to talk a little bit about Alzheimer, the newest drug discoveries,
sure,
what one can do in a preventive fashion, and then, of course, also look into research, the sharing of data, and so forth within the field of Alzheimer. So, Alzheimer, what's new?
First of all, thank you very much for inviting me second time, and this is great to be there for Presentation Tube. I think it's a great way to communicate both to the other physicians, other researchers, and also to the patients. I think it's great. Regarding Alzheimer's, I think we have made enormous amount of progress in terms of understanding the molecular mechanism, and now it's a time to go into therapy and diagnosis. The recent advances in Alzheimer's disease is both at the level of early diagnosis and in terms of some headway that we have made in therapy. There are a couple of antibody-mediated therapies that seem to not only remove this toxic protein in Alzheimer's, but also seem to improve cognition. This is the first time in the history of Alzheimer's therapy that we see that something changes the cognitive outcome. So I think that's a good way to start, but we are not there yet to say that we've cured Alzheimer's.
So when you're talking about toxic material, we of course always want to communicate also with the patients and allow them to understand what we're talking about. What kind of toxic material are we talking about when we're talking about Alzheimer's disease, and where is it located?
It's very interesting. So during the younger ages, our brain is kind of very healthy. If you look at the brain using imaging, the brain, it has these nice neurons and other neuronal cells, and the brain looks pretty happy with blood vessels and etc. Towards around 75 to 80, something like 10% of patients develop this Alzheimer's disease, and you clearly see that these patients have something like deposits or these clumpy-like materials that you see in imaging. And this is what we call as the toxic amyloid plaque. These are plaque materials. These are deposits of a peptide or a smaller version of a protein called the amyloid peptide. And as one gets Alzheimer's disease or as we age, these proteins seem to accumulate in the brain. And as they accumulate in the brain, then they have these toxic properties that would even kill the neuronal cells and synapses. And these are the things that we need to remember. We need synapses, we need neurons. And somehow this material kind of exerts toxicity. And so the way is really to either remove these amyloid, and that's what these antibodies do, or these vaccines are trying to do. And the other way, which we think it is important, is that to also balance, to make these synapses happy, trying to get back these lost synaptic connections.
So how does an antibody target these amyloids? How does it get to the amyloids? Are the amyloids within a cell, within the neurons, or are they outside?
That's a great question. So that's exactly what we do. I'm not a neurologist. I'm actually a cell biologist. I'm a neurocell biologist, trying to figure out where is this amyloid getting produced in the neuron and how is the amyloid plaque is coming together, because when we understand the basic cell biology, then maybe we could devise better therapies. In the case of Alzheimer's amyloid, you have both inside, because that's where it gets produced, and then it gets released, and the amyloid plaque formation happens outside.
We were earlier talking quite a lot about prevention within the discussions that I conducted earlier on today. there are some amazing things going on. You addressed the possibility of a vaccine.
Yeah, yeah.
So do you really see in the next generation kind of medicine that there will be a vaccine? Or what's the timeline? When do you think there could be a vaccine? It's a very difficult question, of course.
It is very different question. The difficult question. The reason is that we need to ask ourselves this question: can there be one vaccine? It's the same way as there can be one drug for Alzheimer's disease. And following the last question, the vaccine is about raising antibodies, either giving antibodies actively or making your body to produce antibodies. And the way it works with Alzheimer's disease is that we don't entirely know how it crosses the blood-brain barrier from the periphery, the antibodies, but there seems to be that there is some amount of antibody that crosses the blood-brain barrier, gets into the brain, and then binds to this outside of the cells, the A-beta, this amyloid peptide. And then once it binds to these toxic protein, this antibody recognizer, it's a bit like how it recognizes viruses or how it recognizes bacteria. Here, it's a different shape. And as a result, it becomes toxic. And so these antibodies bind. And then there are other cells in the brain. These are called microglia. These are like the phagocytic cells. These are usually clearing up things which can be debris or toxic that can accumulate. It's a bit like a scavenger, a cleaning person
Right.
that continuously cleans. And as soon as you see that the amyloid is bound to an antibody, then these cells clear it. So as a result, you could enhance the cleaning procedure by the scavenger cells by the antibody. And that's how it works. So how do we envision the future in terms of antibody therapy? My opinion here is that perhaps in the Alzheimer's disease patient spectrum, which I think that it is, that it's not that all patients of Alzheimer's disease fall into one category.
Absolutely.
I think there is this heterogeneity, there is this spectrum of, and in a certain end of the spectrum or certain band of the spectrum, there are these people who get the Alzheimer's disease because of the toxicity of the peptide. And there I think the antibody is going to work fantastic. We need to figure out how in the other positions in the spectrum, how are these people going to be treated? And for that we need to understand, is it the same amyloid, the toxic protein that makes these people sick? Or is it something else? Or is it a combination? And this is where we think that there is a possibility for a lifestyle-induced direct impact on the synapses. And that can be somehow accelerated by a little bit of this amyloid, but it's not the main cause. So we need to go in a multi-pronged way. We need to attack Alzheimer's disease not just by one way, but perhaps by more than one way.
So when you're talking about this spectrum, you're at least indirectly saying that there are kinds of forms, different forms,
That's right.
individual forms. And therefore, we're kind of going a bit towards personalized medicine.
Absolutely.
In personalized medicine and the era of personalized medicine, we need to find also new ways of doing research. We can't only do not only do the traditional randomized clinical trials. We need also complementary ways of conducting research and also, of course, publishing.
Yeah.
And that brings me to the theme of Science Matters.
Sure.
I think this is a highly interesting initiative because we need more in this era of personalized medicine, and in the next generation medicine we also need to systematically capture observations.
Sure.
So can you please tell me a little bit about
Sure.
Science
I mean, to
Matters?
really, when you think about Alzheimer's disease, I have been in the field for several years, now more than a decade in working in Alzheimer's disease. You see that while we understand a lot, and then there is a lot of research that gets published, And almost every paper that comes out that talks about how we can cure Alzheimer's disease. But then when you come to clinic, when it comes to the actual patient, there is hardly any cure. And so this has bothered me for a very long time. Why haven't we made a cure for Alzheimer's disease already now? And I could come to two conclusions. One is that Alzheimer's disease is not simple, it's much complex, it's a heterogeneous disorder. This is one possibility, and that's exactly what you talked about, personalized medicine, and this is how a cancer field is going, and this is how Alzheimer's field should go. And the other thing, which is much more disturbing, which is much more intellectually not challenging, is the fact that there is this high degree of irreproducibility. And this is an extremely important thing which people don't appreciate very much, is that when researchers publish something saying, look, I found a cure for Alzheimer's that works in the mouse, that works in these cells, but then when you take that result and go into the patient, or even to another lab, this is not getting reproduced. And this is called irreproducibility in science. It could be even as high as 66% to 70% of the research published, it cannot be replicated. So imagine if I do something in my lab, or you do something in your lab, and we cannot reproduce each other's results, though we are in the same city. How can we translate it? And this bothered me quite a bit, this high degree of reproducibility, and this, since it affects patients, since it affects drug development, it affects progress in science. I looked at it several years ago very closely as to why this happens. It has several aspects to it. One of it is really that people try to push their results. People try to sell their story. If I do something in my lab, maybe it doesn't have so much of a value in the sense that it's not there yet. Or I often say that there seems to be a pressure to publish these sexy stories. Every time you do something about Alzheimer's, you would have to sell it in a way that it goes to the press. You read it in NZZ or in Blickenhaven or something. That the sensationalizing a simple observation, I think it corrupts science, and we identified that there is this desire and also a demand to tell stories of science. Storytelling, while it has this fictional component, somehow it is co-opted to science. Every time I have to talk about a scientific observation, somehow there is a demand from the publishing system, and there is also a desire for me as an author, as a researcher, to tell a story around it. If I can't tell a story, I cannot publish. And so we identified this not as the only problem, but actually as a core problem that exists in science, that you can't now publish a good observation, but you have to always have a story behind it. And so the need to tell a story also has this other component. If you can't tell a story, in order to get published, maybe some people make up a story.
Absolutely. Which we have witnessed, of course.
Several times.
Exactly.
Several times. And even in Alzheimer's fields, there are several instances where there is this high degree of irreproducibility. There was a paper published by a very famous Nobel laureate from Rockefeller, published in Nature, and 5 different groups showed that they cannot reproduce the results. And how do you reconcile with this fact that a paper that is published by one of the very well-known researchers in one of the well-respected magazines now cannot be replicated? And so one of the things that determines you as a researcher at the university is where you publish. Not what you publish, but where you publish. And this culture has bred enormous amount of dishonesty. There is this high degree of fraudulence. There is a because when you publish very high, even if it is wrong, then even if it is not entirely correct, let me correct myself, then the incentives are very high. Universities in China give enormous amount of monetary reward if you published in one of these journals. Even here, there are career incentives. So if you publish in one of these journals, then you get this tenure or grants and promotion. And so when the incentives are too high,
right,
then it's not very good for science. There is an indirect way to breed dishonesty. And so this is one of the ways we think that perhaps we should go away from the storytelling. We should go back to these observations that have played key roles in the development of drugs and development of advancement in science. We don't have to go all the way to Galileo, but we could think about Alexander Fleming here. It didn't start by a full story. He just walked into a lab to find out that wherever the fungus was growing, the bacteria wasn't. And this was a great start. This was a great observation. All that he said in that paper in 1928 is this observation. Today, you can't publish this. Today, the journals would ask you, what is the compound? He didn't know about penicillin at the time. Though he called the extract as penicillin, he didn't know the compound, he didn't know the mechanism. Only 40 years later, we would know the mechanism. In today's world, you would have to put all of them together in a single paper. You might even have to cure half the population of Africa in order to get that paper out.
Right.
And this delays the development and the progress of science, because scientists keep the observations very close to their heart, they are very secretive, and then they want to come with the big bang sensationalizing story. So as a result, this stops the progress of medicine. It's the same thing in engineering and technology and different aspects of natural sciences. So Science Matters is not entirely novel. It goes back all the way back to 1600, where Robert Hooke and Galileo, even before, talked about the importance of observation. So Science Matters basically takes that idea and now puts it in the digital format today of giving an old age advice that we focus on observation into the digital era. So in Science Matters, we publish only single observations, but validated observations, not just one-off, but validated observations. And then it gets reviewed, so there are peers who review it, and you publish that without a story. You don't know what the compound is. You don't know whether it will work in the humans, but this is. And then you come back and extend. It's like a Lego, a building of the observations. You don't come with the full story right from the beginning, but
right.
And in the meantime, others can also extend. So as a result, a narrative emerges very naturally as opposed to an author. So that's what Science Matters does.
Yeah, I think it has brilliant potential, obviously, and not only in whether something will be discovered or not, but also in the timeline, in the velocity of progress.
Sure.
And as you obviously know, the average time of drug discovery from phase 1 clinical trials to being out of the market is between 13 and 15 years. That's the average. And so if we can speed that process up a bit through really publishing also single observations, I think that is absolutely brilliant. And so congratulations on that. I think it's absolutely fantastic.
You're absolutely right that as soon as we enable people to publish the single observation and then allow others to validate without taking a moral evaluation of whether it is right or wrong, but can I reproduce the result? I cannot reproduce. Then imagine the data is validated by the author and the others. I think it gives a much better stamp, much better validation, and the pharmaceutical industry can think, by looking at the data, they can see which part of that, or which observation is much more reproduced, which means it's much more reliable, and which are not. And so instead of just investing into papers that get published in journals, like where it was published, we can go back into thinking what I publish and how impactful the observation is. So I'm really excited. We're also going in the future to use blockchain technology to make sure that these observations, when they are submitted, they get a timestamp.
Yes.
As a result, they get credit. They are credited to the person who made that observation.
Which is highly relevant, obviously.
Yeah. That's where we're going. Yeah.
And what about costs? This will be my last question.
Sure.
Then you're
Go
off
ahead.
the hook. But as we know, some journals, they are quite costly. It's very difficult to publish in them, also because of cost. And so it's not so difficult for well-financed institutions to publish there. But we have so many observations or science being conducted, rightly so, also in less resource-rich institutes, and they might be able not to publish just because of the cost. So how is it with Science Matters? Is it expensive to publish in it?
It's a great question. I mean, it's a very important question in terms of the cost burden for authors and researchers. Today, we have two problems regarding cost. The cost is to access published knowledge. So once I publish or you publish, in order for them to read it, they would need to pay $32 per article to publish, right? And so the publishers, who are like the middlemen in a way, they put this high fee to access. And my university, or on an average, a university in Switzerland pays $5 million per publisher per year.
Amazing.
Just not to publish, not to give me money for my research, just to get the access to the data, not the data, but the published article. I come from India. I come from a very modest background, and I have a foundation that supports rural students from India. And when we travel to rural India, they don't even have money to have a basic infrastructure, right, to do research. And now imagine they have to compete with somebody who can pay easily $5 million per publisher per year. And there it isn't. And it's not just the rural part of India, it's like several places. And in 2017, I would consider it even immoral to put a blockade to access knowledge. And Science Matters, by default, is open access. So everybody should be able to read and access data which is published. So it's free for everybody, regardless of where you're from. And to publish, this is the other aspect. In order to make it free and accessible and that we do this quality control, we need to charge some money. And we need to survive and to sustain. So we charge $300 per article, $300 or 300 francs per article. And compared to a competitor, for example, they charge anywhere between $1,300 to $5,200 per article. And I think we are trying to survive in this mode. It looks okay, but largely we do depend on charity and donations. The University of Zurich supports us, and Wirkung, which is a charitable organization in Zurich, supports us with grants. So we largely depend on these grants to make the service, but I think we'll survive. And yeah, that's
I think the initiative is very fortunate to have you there as a role model and as a spearhead, because of course of your accomplishments and your all the prizes that you have won throughout the years. That really helps also for the fundraising and for the financing. So of course that's extremely fortunate. But as you know, we also of course want to support the initiative.
Oh, that would be great.
Very much.
Wonderful.
So.
Wonderful.
And it's very much in line also that the access to published papers and to knowledge. That's of course very much in line with what we are doing, our philosophy and our scope. We are doing our project in order to allow and support exchange between experts on one hand, and on the other hand to create a base for the patients and patient-reported outcomes also to flow in to the research and to the therapies and the choice of therapies. So, of course, this is a philosophy and an initiative that we very much want to support.
Wonderful. I think knowledge shared is something that grows when you share it, knowledge, as opposed to getting diminished. And now we enter into the era of this breaking down the barriers for accessing knowledge, to create knowledge. I hope this enhances, as you said, the efficiency, really, how we get from making the discovery to publishing and sharing. And then one day hope that this time gets much shorter, from making discovery to translation to people.
While maintaining high quality.
Exactly. That's absolutely true.
Laurie, thank you so much.
Thank you.
I'm so appreciative for your time. I know you're extremely busy, so thank you so much indeed.
Thank you so much for having me. Really amazing.